What makes squamous cell carcinoma unique in bladder cancer? Imagine a type of bladder cancer that behaves quite differently from the more common forms. That's what makes squamous cell carcinoma, or SCC, stand out in the world of bladder cancers. It's a rare form, making up only a small part of all bladder cancer cases, but it has some very distinct features that set it apart. Unlike the typical bladder cancer called urothelial carcinoma, SCC shows specific changes under the microscope. It has unique histological features like squamous pearls, intercellular bridges, and keratohyalin granules, which are signs of squamous cell differentiation. These features are not seen in urothelial cancers unless they also have squamous features. One of the biggest differences is what causes SCC. While most bladder cancers are linked to smoking or chemical exposure, SCC is mainly associated with long-term irritation of the bladder. This irritation can come from chronic urinary infections, bladder stones, or the long-term use of indwelling catheters. Over time, this persistent irritation can lead to changes in the bladder lining, which may develop into SCC. Another key point is how advanced SCC tends to be when it's diagnosed. It is often found at a later stage, usually as large, solitary masses that invade deeper tissues. Most cases are diagnosed at stage T3, meaning the cancer has spread into the fat surrounding the bladder. This late diagnosis contributes to the poorer outlook for patients with SCC. It is generally a high-grade cancer, meaning the cells look very abnormal and tend to grow quickly. Unfortunately, the prognosis is often worse than for other bladder cancers, with lower 5-year survival rates and many patients facing serious health challenges within the first year after diagnosis. Treatment resistance is another important aspect. SCC often does not respond well to chemotherapy or radiotherapy, which are common treatments for other bladder cancers. Surgery, especially removing the tumor or part of the bladder, remains the main approach for localized disease. Because SCC tends to be more aggressive and resistant to non-surgical treatments, early detection and surgical intervention are crucial. Patients with SCC may experience symptoms like blood in the urine, frequent urination, urgency, or even urinary obstruction. These symptoms are similar to other bladder cancers, but can be more severe because the cancer is often more advanced by the time it is diagnosed. Recognizing the role of chronic irritation as a risk factor can also help in prevention efforts. In summary, squamous cell carcinoma of the bladder is unique because of its specific microscopic features, its strong link to long-term irritation, its tendency to be diagnosed at an advanced stage, its high-grade nature, and its resistance to typical treatments. Understanding these differences highlights the importance of early detection and tailored treatment strategies. Always consult healthcare professionals for personalized advice, as individual cases can vary widely.